And then you're going to have different fossa on the front of the humerus. Okay, you have, what's this part of the ulna called? So you know? The olecranon. So then the hole in the humerus that dips into is going to be called what? Olecranon fossa. Okay. And then you have the coronoid process on the front part of the ulna, which is different than the coracoid process. So this is coracoid, this is coronoid. And then the part that front part of the humerus, of the ulnar fits into on the humerus is going to be called what? If this is called the olecranon fossa, then this would be called what? Coronoid. Coracoid or not? So it gets a little tricky, just have to make sure you remember the difference between the two. So then, just to review here, you have these, this is the anterior part of the scapula. So what's this part called? Subscapular fossa. What's this? The lateral angle. And this would be the lateral border. And then what's this here? The ear angle. And this side, medial, superior. And then again here, so you have the supraspinous fossa, the infraspinous fossa, and then what's the fossa right here? Glenohumeral fossa. And so then here you have the coracoid process. There's the acromion, and then what's this area right here? It's above the spine of the scapula. It's the supraspinous fossa. So you're just looking at it at a different angle here, right? And so then this is the backside, remember. So what's this fossa going to be here? Infraspinous fossa. Right here. Okay, so on the posterior side you have the supraspinous and infraspinous, and then what's the one on the anterior side? Subscapular fossa. So again, you have the clavicle, so you have the sternal end and the acromial end. So then again, here just to review, you have the head of the humerus, then you have the neck, and then here this the shaft of the humerus, and then what's this tuberosity here? Deltoid tuberosity, right? Okay, and then you have the two articular areas on the bottom, and which one articulates with the radius? The fitulum, and then what articulates with the ulna? The trochanter. And then we have these epicondyles and then the supracondylar ridges. So which one is this? Is this medial or lateral? Lateral. So the radial head's on the medial side, so lateral, and then medial epicondyle. So there's all this thing. A lot of times they differentiate between the anatomical neck and then the surgical neck here. And then again, here's the intertubercular sulcus or intertubercular groove. And then you have the lesser tubercle and the greater tubercle. And we covered this already in the exoskeleton, but just to review the parts of the sternum. Okay? What's this part here? Lubrium, and there's the body of the sternum. And then here's the jugular notch, and then the clavicular notches. Then just to review the ribs, and they attach at the spine here, and then they also attach to the transverse process, and they curve around here. And then we talked about the joints of the pectoral girdle. Have the glenohumeral, which is the quote shoulder joint proper, Right? That's where your actual most of the movements of the shoulder joint occur. Then you have the acromioclavicular joint. And then what's the other joint that's left? Sternoclavicular. And then there's also another functional joint. So you have sternoclavicular. And then in some cases where they talk about, they throw in the sternocostal. In some ways it does participate a little bit in the shoulder movements. And then you have what's called the scapulothoracic joint. And that's not really a true joint per se. There's no articular cartilage. But it's basically where the scapula articulates with the rib cage. So it's basically muscle on muscle. So you have the supraspinatus, the subscapularis muscle, and then the rib cage. So the scapula moves up and down. And when we get into the muscles, we'll be talking a lot about muscles that stabilize and hold the scapula. Okay, those are oftentimes called the intrinsic muscles that help stabilize the scapula to the rib cage. And then we'll have the intrinsic muscles that go across the shoulder, and they're ones that are actually moving the shoulder joint. Then another joint, and this is something that won't necessarily get into a lot for this class, but you'll hear about it later. It's the suprahumeral joint or the subacromial joint. And when you get into orthopedic conditions or shoulder conditions, that's going to come up a lot. It's basically the space underneath the clavicle, and then you have the coracoacromial ligament and the coracoid process. That's what's considered usually the roof of the shoulder joint. Okay? When the shoulder's getting jammed up, it's jammed up into that. And then in that subacromial space, you have a bursa, and then you have the supraspinatus tendon. Okay, people have probably heard a lot about rotator cuff tears, rotator cuff problems, supraspinatus tendinitis, or anybody heard of impingement syndrome? Okay, that has to do with that space. You get an impingement of the bursa or the supraspinatus tendon. So a lot of times people are doing repetitive overhead throwing things, you're compromising that space. Okay? And then we'll talk about the ligaments of the pectoral girdle.
Okay.
So here, what is this ligament going to be called? What are the two? Ligaments are always named from the two bones that they connect. Okay? So what would this ligament be called? Coracoclavicular. And then here is the acromioclavicular. And that's basically just a joint capsule. This is really the ligament that holds that acromioclavicular joint together. Right. Then you have the ligaments of the shoulder capsule. And you have coracohumeral. And these are in your notes, but we're not necessarily going to get into a lot of questions. We're more going to be talking about bones and muscles, but just so that you're aware of what the ligaments are. Okay. Then there is a transverse humeral ligament that holds that bicipital tendon in. Okay. And then the actual glenohumeral ligament, all it really is the actual joint capsule. It just has a couple different thickenings of it.